Hi, I'm Amanda Donkin and I'm here today to tell you a little bit about the healthcare science courses at Swansea University and specifically cardiac physiology. So perhaps I can start off by explaining why people want to become healthcare scientists. And there's about 50 plus professions that come under this heading that are in the NHS, and they take probably those healthcare scientists take part in 80% of the diagnostic decisions that are taken in the NHS. And so therefore, although not everyone knows about healthcare scientists, they're a really important part of the NHS, and a lot of the diagnosis couldn't happen without healthcare scientists. So what sort of people want to be healthcare scientists? Well, it's probably someone who's really interested in science, who's interested in finding out how things work or why they work the way they work. And if you were someone who tended to take things apart to see how, the workings went on inside, perhaps as a child, then you might be the sort of person who would really make a good healthcare scientist, because it's that curiosity and that wanting to know, wanting to find out the diagnosis for patients and wanting to see what's going on that really sort of drives people to find the right diagnosis for patients. The other thing that we're really looking for is we're looking for people who perhaps have altruistic approach, that they're interested in healthcare generally, they're interested in people's health, the public's health, they want to improve the health of the public at large, and are interested in their own health and, interested in sport and keeping fit and a healthy diet and things like that, really. So therefore, if you're naturally inquisitive and you're interested in general well-being of yourself and other people, and perhaps if you're a really good problem solver and you want to find out why things happen and how things happen, you probably would be a good idea if you enjoyed science, because there's an awful lot of science in the course and in the profession. And I think it really helps if you want to work with people, because this is a very patient-facing role. So healthcare scientists, particularly cardiac physiologists, work with people every single day. They work with people of all ages, from all backgrounds. So it really helps if you've had experience with dealing with people and talking to people and, really getting on with different types of people. The future for healthcare scientists is very rosy, really, because there's quite a few areas that you could go into after graduation, and that might be something like the armed forces, or it might be working for a company that makes the equipment that we use, or it might be working in the NHS. And really, the majority of our graduates do go and work in the NHS. And the expectation is that you would, on graduation, work in the NHS at a band 5. So that's quite a good grading, and lots of our students, once they start working in the NHS, there's a very good career structure now, and recent graduates have found that they can progress through the NHS through this very well defined hierarchy, and quickly improve and do further education to help them increase their career prospects. So I want to tell you a little bit about cardiac physiology specifically, rather than just generally healthcare science, because no one really knows, unless they've had dealings with a cardiac physiologist, what a cardiac physiologist is. And that's really because, unfortunately, you won't see us on shows like Holby City or Casualty, although other hospital dramas are available, of course. But we tend to be one of those professions that works in the background and no one really hears of unless they come into direct contact with us as patients. And really, we do lots of investigations on patients to try and diagnose if they've got cardiac problems, or perhaps the depth of their cardiac problems and what's the best treatment for people. We also help in the treatment. So not only is our profession diagnostic, but they're also therapeutic. So we would take part in the treatment of some patients and help them to improve their health. Really, the sort of investigations that we do, some of them, the more basic investigations are things like recording ECGs, recording blood pressures, and then as we become more adept at doing the different investigations, we might move on to exercise tolerance testing, monitoring people's hearts for 24 hours, people's blood pressure for 24 hours, and then we can go on to invasive techniques such as coronary angiography and coronary intervention, which takes place in a cath lab. We also take a large role in electrophysiological studies and device implantation. Also, a large area is ultrasound now, which lots of people have for all sorts of different reasons. We might do any of these investigations on a baby or an elderly person or anyone in between, really. So, as I said, it's important that you get on with people well and you're able to change your approach depending on the age and person that you're dealing with at any particular time. Just a little bit about the Swansea course then, to say, what is the Swansea flavour really, and, why is it a good thing for people to come to Swansea? Well, Swansea has a gold award for the TEF, which is Teaching Excellence. They're one of the top 10 universities in What Uni results. And the way that we structure the Swansea course, it means that we have lots of different people teaching on the course, feeding into the course, but the people who teach the subject specialist areas, the cardiac physiology areas, are all practicing cardiac physiologists themselves. So we're not just in the ivory towers at the university, we really know what's going on. We're still working in the NHS very often, and we know what it's like at the sharp end. So that can inform our teaching and really makes the teaching current. We also have members of the team who are involved in research. So again, that can feed into into teaching, and so we like to think of our teaching as research-led and practice-driven, because those things are feeding into our teaching. We're very much conscious to develop critical thinking in our students. This is a really important skill, particularly when you're using evidence-based practice in the NHS. And so we feel that's a skill that our students need to develop early on in the course. And we'll certainly give you a diverse clinical experience, because on our course our students go all across Wales. We have hospitals in North Wales, West Wales and South Wales, all along the M4 corridor, and it really does give our students diverse clinical experience. And we think that's different to some other universities who don't have the same format for their course. And by the end of the course, the students really value this ability to travel around the different hospital departments, because they see different patient populations, they see different parts of Wales, they also see different equipment, different approaches, and so by the end of the 3 years they're really starting to develop a sort of a very clear professional identity because of all this input from different areas. And employers have fed back to us that it really helps our graduates develop a flexible approach, and they become good problem solvers as a result of this wide clinical experience. The Welsh Government does fund the course. They will pay the tuition fees for the course, and they will also pay bursaries for our students, so that really helps in the students' experience. However, the Welsh Government, if the students are going to access this funding package from the Welsh Government, they do need to commit to work in the Welsh NHS for 2 years post-graduation. If you want to find out more information about that, you can find that out by looking at NHS student bursaries in Wales, and you will find out more information about that particular funding package if you wish to do so. The course has a variety of teaching methods. We have quite small cohorts. At the moment, the Welsh Government is funding 24 places. And so, relatively speaking, to lots of universities, this is quite a small course. But that means we get to know the students really well. We get to know, they get to know us really well, and we have quite a good rapport because they find us quite approachable, and we can chat about things and usually find a resolution to any problems they have. So the small class sizes are a good thing. The largest class size that you probably would be in our healthcare science courses is about 50 to 60, which relatively is a small lecture for universities. But as I said, the subject specialist area is 24, and when you're doing the subject specialist lectures, that would be the number that you would be with. And we do all sorts of different approaches. We do practical sessions, lots of practical sessions. We do seminars and lectures, and we have e-learning, and all these things feed into the good experience for the students. We also do different types of assessments as well. So we might do presentations or essays or exams, and all this feeds into areas where the students usually find something that they can really excel at. So we find that works quite well, giving a wide variety of approaches for teaching and a wide variety of approaches for assessment. Often people ask about the things that make a good application to university, and I think the things that would be helpful for people to tell us about when they're going to apply to the university is things like what they know about cardiac physiology, their passion for it. We do recommend that people try and get a shadowing experience at a hospital, so they really understand the role of the cardiac physiologist. And also, if you've done things like dealing with people, perhaps you might have a part-time job or you do some volunteering, then telling us about that and how you've interacted with people will help show us how you might have some of the attributes or skills or characteristics that a cardiac physiologist needs to be good in their profession. So anything that you feel is relevant in those sort of areas, but tell us about what you've done to show us really what what skills you've gained. So if you want any more information about this, then you can contact us at chhsadmissions@swansea.ac.uk.